Awesome. Good morning. I'm Marisol Luna Pisano. I'm a family medicine doc from North Hollywood, MOB in Panorama City. And I am delighted to introduce another colleague of mine from Panorama City, Dr. Regina Ragassa. She graduated from Nova Southeastern University in Fort Lauderdale, Florida, and completed her family medicine residency in Lutheran Medical Center in Brooklyn, New York. She came back to her stomping grounds in the San Fernando Valley to start her career with KP at Panorama City. Driven to improve her patients' chronic conditions, she was inspired by a colleague, Dr. Luenda, to learn more about the benefits of lifestyle medicine, and she became certified in 2020. She has worked with the Center of Healthy Living on establishing 2 successful plant-based tracks in English and in Spanish, and she personally taught both courses herself. As of 2022, she enthusiastically took on the role of the Regional Co-Chair for Lifestyle and Obesity Medicine and is working with her colleagues to expand lifestyle medicine practices to all KP physicians. She now serves as the Chief of Obesity Medicine at Panorama City. On a personal note, she's the mother of 2 amazing, adorable little girls. And if you don't follow her on Instagram already, you should, and you need to, because she has some inspiring content. She's always authentic and real about the plant-based diets and lifestyle, sharing her own journey with her followers. We are excited to have her here today. Please join me in welcoming to the stage Dr. Ragassa.
Thank you so much for having me here today. I feel so incredibly honored that you guys are all taking a chance on me and hearing this talk. Oh, where's my little clicker? Here it is. Okay, awesome. Okay, so let's get to it because I have a ton of information. Let's see. Yep, you all know you're here. Okay, great. So this talk today was inspired basically by working as a primary care doctor. Over and over again, we hear our patients complaining about their belly hurting, abdominal pain, and all of those issues, right? In terms of acid reflux, we know that it affects up to 1 in 3 persons, and that's about 69 million Americans. When it comes to diverticulitis, the rates of admission had increased by 26% in a 7-year span. I only have numbers up to 2005. Thanks a lot, up to date. Not so up to date, but that's about 3 million Americans. Inflammatory bowel rates had also increased 2-fold in a 20-year span. And when it comes to constipation, apparently no Americans know how to poop. I think this is an underestimated number. It says about 4 million people are affected by this, but I know a lot of us don't actually tell our doctors that we're constipated because it's kind of an embarrassing topic, right? But for those who are highly impacted by this, it's resulted in about 2.5 million physician visits a year. So this is a really big problem. And I think to understand all of this, we have to go beyond the anatomy of or the gross anatomy of our intestines, and even beyond like the microscopic level. And what we really need to look at is the inhabitants of our intestines. So today, we're gonna be focusing on microorganisms. We have 5 different types of microorganisms that could potentially live in us. We have bacteria, yeast, parasites, viruses, and archaea. Bacteria are the ones who really predominate in our intestinal microbiome. There's lots of those. There's good and bad, which we'll go into in a little bit. We also have yeast. I feel like yeast kind of has a bad rap. Whenever we talk about it, we always think it's a bad thing. But I think us as physicians, we know that we can live in symbiosis with this. It's just we need to keep them in check, right? Parasites are probably the only things we don't want in our intestines. I don't know of any good parasites yet. If you guys do know, please let me know. In terms of viruses, this is another thing that tends to get a bad rap, but also, there are actually good viruses that work with our bacteria to also help them function properly. And then lastly, we have archaea. You can see there's a little dinosaur there. They've been around for 4 billion years. These are really resilient types of microbiomes that live inside of our gut. So, with all those things together, in terms of species, there are anywhere between 300 to over 1,000 different types of species in our gut alone. And if you were to count each and every single little cell, papers have cited there's 39 trillion microorganisms in our guts. And in fact, there are even some other studies that cite up to 400 trillion microorganisms inside of our gut. Do you know how many human cells exist in your body? It's like 36 trillion. So if you were to think about this, we're like half microorganisms and half human, or up to like 90% microorganisms and 10% human. So it's really important to take care of that gut microbiome and keep it as healthy as possible. All right, so as all of you know, there's good bacteria and bad bacteria. This was kind of my extent of understanding our gut microbiome before I started working on this talk. There's the good ones that promote the health and balance of our body, as well as reduce inflammation. Obviously, when this gets thrown out of balance and we have more of the bad bacteria, it increases inflammation. And it can also increase inflammatory markers like TMAO that can lead to certain chronic diseases like diabetes and weight gain. All right, so again, when things are thrown off balance and the bad bacteria kind of take over the good bacteria, we call that dysbiosis. So it's not in an optimal range anymore. And I think a lot of us are familiar with the symptoms that might occur with us when we have dysbiosis, like the intestinal symptoms of like abdominal pain, bloating, constipation, diarrhea, mucus in the stool. I have a lot of patients that actually complain about that, and I'm like, I don't know what's up with the mucus in the stool. We'll talk to GI about it. But interestingly enough, it's not limited to just intestinal symptoms. When you have dysbiosis of your gut microbiome, it can also result in extra-intestinal symptoms, including weight gain, fatigue, brain fog, not thinking very clearly. Sometimes you can have mood imbalances, having worsening anxiety. This can also be reflected in our skin, and we see it in the forms of eczema or acne. You can have musculoskeletal pain, halitosis, some stinky breath coming up. We got some sinus congestion, wheezing, and weakness. We don't really think about our gut microbiome when we hear this complaint from our patients, right? All right, so I'm gonna nerd out a little bit here, and we're gonna get into the nitty-gritties of this. Obviously, I am now part of obesity medicine, so I'm really interested in how our gut microbiome can highly influence that. And studies have shown that there are two predominant types of bacteria that live in our gut microbiome, and they find that you have to have the right ratios of the Bacteroidetes versus the Firmicutes. And what we really want is higher levels of the Bacteroidetes versus the Firmicutes, and when that happens, they find that patients that have that higher level of the Bacteroidetes are able to maintain their body weight better. Interestingly enough, when that starts to flip and you have more of the Firmicutes versus the Bacteroidetes, you end up having trouble maintaining your weight and you end up gaining more weight over time. They've even done stool transfers into mice, and when they transfer that type of ratios of the higher Bacteroidetes, again, they're able to maintain their weight, but when they have the higher levels of the Firmicutes, these mice actually end up gaining weight. So this is really, really important in helping to regulate all of our hormones. When we have the right levels of everything, we have higher levels of the leptin, lower levels of the ghrelin, higher GLP-1s. Did you know that the foods that you eat can help you produce GLP-1s? And here we are trying to spend like a couple $1,000 a month trying to inject ourselves with this stuff, right? And then there's also PYY, another type of hormone that we produce to help improve satiety. Okay, so it goes beyond just weight gain. It can also affect us hormonally in the females and males. So again, I'm gonna geek out about this because this is really cool. In terms of, I kind of advanced that a little bit soon, but our body, the way that it helps to regulate our hormones, so basically, estrogens are produced by our ovaries as well as our subcutaneous fat, and our liver, helps to regulate that. And the way it does is like, oh, these levels of estrogens are really high, so we need to get rid of this. So it binds it to what is it called? Glucouronic acid, thank you. Glucouronic acid, and by binding that, it's secreted through the bile, and we're supposed to poop this out, all that extra estrogen. Interestingly enough, when we have the higher levels of the bad bacteria, it produces an enzyme that cleaves that bondage, and now you have free-floating estrogen within our intestines, and now it's able to be reabsorbed into our system. So we have higher levels of the estrogen, and these higher levels of estrogen in our blood can lead to endometriosis, can also lead to endometrial hyperplasia, and increase our risk of breast and endometrial cancer. I had a personal experience with this. Well, maybe not personal. I had a patient with this experience who was so moved by the changes in her diet that had improved her endometriosis that she wrote an article about it. So this is really, really important, and one way that you can easily help your patients gain their health back. On the other side, we also have excess androgens. So again, our liver helps to get rid of the extra glucocorticoids that we have in our body by secreting it through the bile. Most of it is excreted through the urine, but there's a small amount that comes through the bile. And for the small amount that comes through the bile, again, if we have the higher levels of the bad bacteria in there, it produces an enzyme that cleaves that glucocorticoid and turns it into androgens. And again, now you have the free-floating androgens that are able to be easily reabsorbed back into the body, and guess what? We have PCOS now, right, with those higher levels. So again, if we're able to eat those higher fiber diets that supports the growth of the good bacteria, we're able to bring balance back. This can also affect men. This is not only a female issue. So when we have increased intestinal permeability and the bad bacteria producing more of those endotoxins, it can, again, be absorbed into the bloodstream, decreasing your testosterone production and therefore decreasing your sperm production as well. Okay, I think a lot of you might be familiar with the brain-gut axis, right? We know that there's some strong connection between the two, and this slide will hopefully explain that even better. Our gut microbiome is able to respond to and produce over 30 different neurotransmitters. 90% of serotonin and 50% of our dopamine is produced in the gut. That is why we have this really tight connection between irritable bowel syndrome and stress and anxiety, right? Before I put this talk together, all I thought was like, well, you have IBS, I'm really sorry. I think you just need to control your stress levels better. But maybe they can't control their stress levels better because they're not producing the serotonin and the dopamine they need. So this is a really vicious cycle, right? So it's, again, really important to take care of that gut microbiome. All right, we all know that antibiotics can also highly influence our gut microbiome, but how so? We know that in ciprofloxacin, when you take this, it destroys up to 1/3 of our gut bacteria. And we know that it kind of kills whatever's in sight, right? It doesn't really care and it doesn't target the bad bacteria necessarily. It's just like, hey, whatever's there, I'm gonna get you. It takes about 4 weeks to recover from ciprofloxacin, and unfortunately, even 6 months after you've taken the antibiotics, there's still evidence of the good bacteria not necessarily coming back to where it needs to be. Clarithromycin and metronidazole have similar results. Evidence of the good bacteria that haven't fully recovered is still there about like 4 years later. We don't see it fully recovered. And then when it comes to broad-spectrum antibiotics, it permanently destroys 9 beneficial species of bacteria in our gut. So we all know that by taking antibiotics inappropriately, this can build up more antibiotic-resistant microbes, increases the risk of infection, allergic conditions, osteoporosis, and also obesity. What about other medications? There are other medications that also affect our gut microbiome. We know that proton pump inhibitors, sorry, this kind of came out funky. Proton pump inhibitors can increase the risk of C. diff. I think a lot of you are already familiar with that, but it also increases the risk of SIBO, right? And small intestinal bacterial overgrowth. In terms of NSAIDs, we know that it does increase the risk of ulcers, but also increases the risk of inflammatory bowel disease and also microscopic colitis. And this was a really interesting one. It turns out that OCPs can actually increase the risk of Crohn's disease as well as ulcerative colitis. I'm not trying to say that we shouldn't give OCPs to our patients, but maybe if our patients are suffering from Crohn's disease or ulcerative colitis, we should consider alternative methods of birth control that wouldn't affect their gut microbiome as much. All right, so we're gonna go to our first poll. And my first question to you, because we're gonna get into food, that's what I love to talk about. Do you mind bringing the poll up and then maybe I can talk about that plate? Awesome, thank you. So the first question is, what % of Americans meet the USDA recommendations for consumption of fruit, vegetables, and whole grains? Do you think it's 90%, 70%, 50%, 15%? Does pizza count? Unfortunately, that does count. Apparently, when they're coming up with the school lunches and stuff, the tomato sauce counts as a vegetable. Okay, so I wanted to go over my ChooseMyPlate.gov. So this is the USDA recommendations for how we should be eating. Basically, very similar to yesterday's lecture, Dr. Nguyen had talked about that 9-inch plate. Half of it should be veggies, and then you half the remaining half, so you have a quarter of your protein and a quarter of whole grains. And it's the USDA, they love their milk, so they're gonna put milk on there as well. All right, you guys are really on top of this. All right, so I'm getting the majority of answers at 15% of Americans get enough. I have some true believers in here that think about 70% of us get enough of our fruits and vegetables, and a couple people who also believe that pizza counts, because it does. All right, cool. So let's see what the survey says. So survey says only 12% of Americans get enough fruits in their lives, 10% get enough vegetables, and 10% get enough whole grains. We're doing very poorly at this. The diet that we consume is not the diet that the USDA recommends. Instead, what we consume is called the standard American diet. What the heck is the standard American diet? The standard American diet, when you look at the calories consumed by us, 57% of the calories consumed come from refined and processed foods. That's not even real food. 30% come from animal products, and there's that 10% they were talking about, the 11% from the whole grains, the fruits, and whole plant types of foods, right? I think the standard American diet is rightly named so. The acronym is SAD. This is a very sad diet. All right, so let's focus more on the refined sugars or refined carbohydrates, right? All of us know that sugars are not good for us. So just to kind of give some stats out there, the average American yearly consumes about 152 pounds of sugar per year, and also 100 pounds of refined carbohydrates. Unfortunately, there's no diversity in this, so this ends up hurting our gut microbiome. So we lose that diversity, and it will increase inflammatory bacteria. And you're like, duh, we should definitely be avoiding sugars. That's why we have Diet Coke, right? Well, unfortunately, that's not a good answer either. Diet Coke, apparently artificial sweeteners, can be up to 20,000 times sweeter than regular sugar. So for those people who have diabetes or might have sugar cravings, this does not help them quit. This is just pinging that thing much harder, right? They want that sugar even more. When they see that piece of chocolate cake, it looks even more enticing because that super sweet Diet Coke that they had. Unfortunately, this also disrupts the gut microbiome. You know, a lot of our patients, when they have diabetes, they turn towards the Diet Coke. I'd like to share the next study with you that actually shows you when people consume artificial sweeteners, prior to that, they probably had pretty good response to glucose when they're exposed to it. But after being exposed to artificial sweeteners regularly, they have poor control over their sugars. So this is a really poor slide, I have to admit that. But you can see here that the non-caloric artificial sweeteners, that's the NAS, when they're exposed to it, especially the top part of the graph over here, you're looking at that really huge curve. And you can see that you have a higher glucose spike when people consume the non-caloric artificial sweeteners compared to those, compared to when they weren't exposed to that. So I would not promote artificial sweeteners among our patients with diabetes or prediabetes. Aspartame is a really common sweetener that we find in our diet beverages. We use it in our sweeteners. We also have it in breakfast cereals, chewing gum, and cough drops. This doesn't necessarily disrupt our gut microbiome or change the balance of it, but it does make our bad bacteria produce more of this toxin called cylindrospermopsin that can be very harmful to the liver and the nervous system. Trehalose, this is like the biggest shocker, and you'll see why in a little bit. This is a very common sweetener still used today to help stabilize food and improve texture. It's used commonly in pastas as well as meats, and even in ice cream. I had never thought that ice cream and meats would be in the same category, but apparently they are. So there was a study basically trying to figure out what was going on. We saw that in 2000, this is when the FDA approved trehalose as a generally recognized safe food, so it received GRAS status. So once something receives that, then they're able to add it to foods safely for us. Interestingly enough, once trehalose was introduced to our food system, we saw that there was an increase in rise of C. diff. And C. diff rates were increasing exponentially. We were starting to see that younger people were getting C. diff infections when this was typically just found in older patients who had, a decreased immune system. And so scientists were kind of wondering, hey, is there a connection between this? And so they did put it to the test, and they found out that the deadliest strains of C. diff actually grew better on trehalose versus other sugars. Not only that, it increased the virulence, and when they put this in mice, it actually tripled the fatality rates. Sadly enough, it already has GRAS status, so it's still being used regularly in our foods. All right, so our next poll, I have 2 polls for you. I wanted to know what you all thought. What percentage of the US population gets enough protein? Is it less than 10%? Do you think it's 35%? C, 75%? Or greater than 95%? What percent of the US population gets enough protein? Okay, so we got some people thinking here that maybe we don't get enough protein. We need to focus on that more. We have very few people think that we get plenty of protein. 75%, that's pretty good. Yeah, okay. Not to totally jump to the next question, but you're able to vote on the next one. The next question I have after this is, what percentage of the US population do you think gets enough fiber? So those fruits and veggies, remember that last question that we went through. So is it less than 10%? Do you think it's about 35%? 75% of the US population gets enough, or more than 95% gets enough fiber? My husband told me if I didn't know what to talk about, then I should just do the Jeopardy song. But I'm not going to sing for you. I know I'm half Filipino and I should have a beautiful voice, but I don't. All right, so, okay. So yeah, I mean, you guys are picking up. That's awesome. I'm really happy to hear that. Some of you are total believers and think at least 35% of us get enough fiber. That's cool. All right, cool. So let's go to the next one. So let's figure out what those numbers are. In terms of protein intake, the recommendations from the USDA are that for women, get at least 46 grams of protein per day, and men are supposed to get about 56 grams per day. If you're really going to calculate it by ideal body weight, then it's like, I think, 0.6 to 0.8 grams per kilogram. But this is just kind of an average, right? So if we're aiming for that, are Americans getting enough protein? Turns out we're doing great. 97% of Americans get enough protein. Not only that, we get twice the amount. We are rocking it when it comes to protein, right? When it comes to fiber intake, women are supposed to get 25 grams of fiber per day, and men are supposed to get about 38 grams per day. How many people are getting it? 3%. We are very sad, right? So I think this is the wrong question to ask. Instead, we should be asking, are you getting enough fiber? That should be the true question. All right, so when I was putting this talk together, they said you have to talk about Practice Wizard, and I was like, what's that? I had no idea where to find it, and I'm not going to spend 2 minutes looking all over Health Connect for this thing, so I just typed it into the search bar. Even after yesterday's talks, I was like, oh, it's that's where it is, that's cool. So you can type it into the search bar where Practice Wizard is, and for our example today, we're going to talk about constipation. I just decided to look that up. And the great thing, again, as you had seen yesterday, it gives you how to screen and diagnose certain things. In this case, it talked about management as well, so anywhere from fiber supplements to laxatives to enemas, and how to prescribe that, which I found very helpful. And I think my favorite part of this is the patient education. They have little handouts that you can give out to your patients in multiple languages. In this case, they have it both in English and Spanish. I wanted to just share that example with you. Here is the handout I wanted to pull out, which is fiber, constipation, and weight control information. Here's, it tells you, hey, eat at least 30 grams of dietary fiber per day. I'm like, okay, that's cool, that's good advice. And I think my favorite line over here is choose beans, peas, and lentils instead of chicken and meat. So I didn't write that, by the way. Someone else did that. So I was like, okay, cool. They're there. The other great thing, too, is they also kind of give examples of what foods have how much fiber. So that could be a really nice starting point for patients if they want to increase their fiber. All right, so let's go back to proteins again. There's obviously a difference between animal proteins and plant proteins. And obviously, for those of you who had listened to my lecture yesterday, you know that I'm always pushing for the plant proteins. But even yesterday in our lecture with nephrology, Dr. Guile, he said that the studies have shown that with chronic kidney disease, you should really be promoting more plant proteins because it's more gentle on the kidneys, essentially. And same thing for the gut microbiome, actually. And when you tend to eat more animal proteins, it does increase the inflammatory microbes. Amines are present only in animal products, and this increases food sensitivities. When we char it, so when we go to barbecues, it actually produces carcinogens. Sulfides are found in animal products, also associated with ulcerative colitis. And meats, when they're exposed to our gut microbiome, they will produce secondary bile acids, which is associated with cancers such as colon cancer, esophageal, stomach, small intestine, liver, pancreatic, and biliary tract cancers. Plant proteins, on the other hand, are really good for you. They're anti-inflammatory. They promote the growth of those anti-inflammatory species, and they suppress and tell the bad bacteria to chill out, like don't mess, we're good. All right, TMAO is kind of a controversial and hot topic within the science world. It's this new marker that we've been tracking, and we find that when the gut bacteria are exposed to L-carnitine or choline, it does produce more TMAO. So higher levels of TMAO will actually increase the risk of chronic diseases like heart disease, stroke, Alzheimer's, type 2 diabetes, CHF, AFib even. The great thing is you can totally reverse all of this. When you avoid red meat for 4 weeks, you can dramatically drop the amounts of TMAO levels in your blood. The other great thing, too, is when you adopt more of a Mediterranean diet, you can even reverse heart disease, right? This is something that we don't learn about, unfortunately, in medical school. We tend to think that once someone's diagnosed, all we can do is kind of keep you stable, and hopefully you don't progress. Okay, this is my favorite slide, and everybody needs to walk home with this information. This is the one slide I want everyone to walk home with. WHO, the World Health Organization, has declared processed meat a class 1 carcinogen. Processed meats includes hot dogs, sausages, bacon, salami. This is commonly found in all of the supermarkets, was served for breakfast yesterday. And we kind of poo-poo this. We're like, yeah, well, it's totally fine. But you know what else is a class 1 carcinogen that we always tell our patients to stop doing? Smoking cigarettes. Smoking cigarettes will increase the risk of lung cancer, right? And we always tell them, listen, I don't care if you're smoking twice a week. You should not be touching it. Do you know how much processed meat you have to consume every day to increase your risk of colon cancer? It's only 50 grams of processed meat daily. That's equivalent to less than 2 slices of bacon a day. And that increases your risk of colon cancer by 18%. Do you know how many cigarettes you have to smoke in order to increase your risk of lung cancer by 26%? Shout numbers. This should have been a survey. What was that? 3 packs a day. That's a lot. More than that? 35 cigarettes per day. That's almost 2 packs a day. 2 packs a day versus 2 slices of bacon. That's crazy. And then a class 2 carcinogen, red beets. Sorry to break it to you guys. The World Health Organization has declared all land mammals, so that includes pork, beef, and lamb, as a class 2 carcinogen. It's a probable cause of cancer. So, I get it. We can live life, right? We can have it fun from time to time, but this shouldn't be part of our regular diet. So please, please, please counsel your patients on reducing the amount of red meats in their diet and avoiding processed meats in general. I think the one thing that kind of pisses me off a lot, I think I'm allowed to say that because I heard the word fuck yesterday. So the one thing that really pisses me off is that, just a couple years ago, we lowered the cancer screening for colorectal cancer from 50 years old to 45-year-old. But we're not exactly preventing cancer, we're just detecting it earlier. Why is it that our American population is developing colon cancer in their 30s and 40s? This is something that's supposed to only, well, hopefully not ever happen, but if it's supposed to happen a lot later in our lives, right? We need to protect our patients. We need to protect ourselves and our family members. So please, 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 take pictures of this slide, take it home, practice it, okay? All right, let's switch to fats. There's the good, bad, and ugly. I think you guys are all pros at this, but we'll go through it anyway. So the good, we have the MUFAs and PUFAs. That's the monounsaturated and polyunsaturated fats. They promote the growth of beneficial microbes as well as correcting dysbiosis, which is really great. An example of that is olive oil. I'm not asking everyone to drink a bottle of olive oil when you get home. I'm just saying it's better compared to the bad and the ugly. Okay, so bad fats would be your saturated fats. That increases inflammatory microbes and increases intestinal permeability, as well as in increasing the amount of endotoxins that are released. The saturated fats, by the way, are primarily found in animal products. It is found in the plant world as well, and these are more in the tropical oils. So that's like your coconut oil as well as palm oil. So try to limit that as much as possible. And then lastly, the ugly. We all know how bad trans fats are, right? It increases inflammation in our bodies, typically found in baked goods, chips, fried foods, non-dairy creamers, and margarine. I always practice my talks with my husband, and he was like, whoa, non-dairy creamers. He's like, we're vegan, is that okay? And I was like, no. Non-dairy creamers, it doesn't apply to the oat milks or the almond creamer that you're probably putting in your milk. It's really the non-dairy creamers, which are like the Coffee Mate little things that you put in there. There's trans fats that they put in there that make it worse. The way they can get away, by the way, with non-dairy creamers and calling it that is because the FDA considers milk derivatives not to be dairy. I don't really know how that works, but there's definitely dairy in there. Okay, so let's switch over to fiber. There's two different types of fiber. Again, you guys are all familiar with this, but there's soluble fiber versus insoluble fiber. Both of those are really good for you. The soluble fiber is the stuff that our gut microbiome likes to eat, and the insoluble fiber is like what I like to call like a loofah. For those of you who don't use loofahs, it's something you use to scrub your skin and keeps you nice and soft. So the insoluble fiber is like that loofah that goes through your intestines and just comes out the other end. So it keeps you nice and clean. But again, our gut microbiome likes to eat the soluble fiber. All right, so now we're gonna get into biotics. Before I put this talk together, I was only really familiar with probiotics and how sometimes we ask our patients to take more probiotics to like prevent yeast infections and whatever else, and maybe help our intestinal gut, right? But there's more than just probiotics. There's something called prebiotics. That's the stuff they like to eat, so like the soluble fibers. And then there's postbiotics. So when they eat that, they make postbiotics. So let's dive into the details of this, focusing on probiotics first. Probiotics, what do I think about them? I think they can be really helpful for our patients when they consume them and they're like, oh yeah, I feel better when I take it. I'm like, okay, I'm not here to rock the boat. You can spend your money on that, that's cool. But probiotics, really the way that they work is as you swallow them, they are alive. So when you take them with food, it digests the food for you and that's all wonderful, but it does come out the other end. So you're just kind of pooping away your money. What's probably better is to kind of get it through your foods. And where you can find a really high amount of probiotics is through fermented foods. Fermented foods, you have to grow it in an acidic environment. And because it grows up in an acidic environment, it promotes the growth of good bacteria. And basically, the bad stuff stays out. The great thing about these good bacteria, it even breaks up pesticides, so your food is even cleaner. And in as little as 1 milliliter of food, there is 1 billion microorganisms in there. So you can get a lot of great probiotics from just eating it through your foods. Probiotics are really wonderful. They help produce K and B vitamins, as well as melatonin and GABA, which can have this really calming effect and even lower your blood pressure. Some examples of these fermented foods include sauerkraut, miso, and kimchi. In terms of sauerkraut, it's really high in vitamin C, has isothiocyanates, which are cancer-fighting. We also have miso. Miso is really great at fighting different types of cancer, like breast cancer, colorectal cancer, and liver cancer. It can improve blood pressure and promotes healthy bones. Kimchi is great at lowering cholesterol, can help with weight loss, has anti-inflammatory and anti-aging properties. No wonder the Koreans have really good skin. And also improves insulin sensitivity and also cancer fighting. Some other examples of lots of probiotics in our foods is sourdough bread. This is actually really well tolerated by patients who have gluten sensitivities, so that is maybe a type of bread that they can enjoy. Kombucha has been popularized in the last several years. It has lots of great properties as well, lots of vitamins for us, antioxidants, healthy acids. Usually when you buy a whole bottle, it's like a 16 ouncer. You don't have to drink all 16 ounces at once. In fact, we only recommend about 4 ounces per day. And to help to protect the enamel of your teeth, try to cut it with water. So that whole 16 ounce can probably last you a whole week. And then lastly, tempeh. Tempeh is very similar to miso. They're both based on soy, and they have cancer-fighting effects. Same thing for breast, colon cancer, and liver cancer. Same other great blood pressure things and helping your bones. Okay, so probiotics are your gut microbiome, essentially, and you can find large amounts of them in your fermented foods. A lot cheaper than buying those probiotics. Now, in order to keep your probiotics happy and healthy, we gotta feed it, right? It's like your pets at home. You gotta feed your pets. And these pets really like all of these things here, fruits and veggies. So prebiotics, oops, I went too fast. But anyway, so you're like, okay, well, they like fiber. That's cool. I can totally just have Metamucil, right? And hit my 25 grams or my 35 grams. Done. No. So apparently, our gut microbiome is actually quite bougie. They get bored with the same food all the time, and they really like diversity. So much that Dr. Rob Knight, who has done lots of studies on the gut microbiome, says that the single greatest predictor of a healthy gut microbiome is the diversity of plants in one's diet. And the magical number here is 30. You want to eat at least 30 different types of plants per week. I know, right? That's a lot. I think I'm like maybe at 20. I'm getting there. Okay, so that means we should taste the rainbow. Not this rainbow, but that rainbow, okay? Just as an example of how wonderful this is, you know, apples, in just one apple, it's got over 100 million microorganisms in there. And not only does it come with the microorganisms, it also comes with the fiber, the soluble and the insoluble that our body likes to eat anyway. It's like all rolled into one. So I think there is some truth to the age-old saying of eat an apple a day keeps the doctor away, right? Okay, beans are another source of soluble and insoluble fibers. Other reasons to love them is they have what we call a second meal effect. So when you eat beans with your food, So when you eat beans with your food, it actually decreases your blood glucose levels. And why it's called the second meal effect is because when you eat your second meal, even if it doesn't have beans, the beans from the first meal help lower the glucose in your second meal. It decreases fat absorption, improving your cholesterol levels as well as blood pressure, increases satiety, which leads to more weight loss, and of course, we're feeding the good bacteria that decreases inflammation, so it can decrease our CRP levels by 40%. Now, some of you might be thinking, listen, Dr. Grassa, that's wonderful advice, but I bloat as soon as I see beans. And I get that, you know, that can be really scary. So unfortunately, if you bloat at the sight of beans or even just having a bite of beans, it means that your gut microbiome may not be strong enough to handle this. But that doesn't mean that you should stay away from it, right? We don't tell our patients who are just couch potatoes to just stay on the couch. We tell them, start with something. Start with like literally getting up and walking around the house. And when you feel comfortable with that, challenge yourself a little bit more. And I think the same thing of beans. So what I tell my patients when they tell me that they get really bloated with beans is to start with literally a tablespoon of beans per day. That could be like 4 or 5 beans. And you're like, whoa, that's kind of ridiculous. But you have to be consistent about it. So you have those 4 or 5 beans every single day for about a week. Hopefully that hasn't caused any bloating. If it did, maybe you want to start with even a smaller amount. But if you're able to tolerate it, then the following week you add another tablespoon. And every week you add another tablespoon until you get to a full serving. Sometimes this can take a couple months. But with the persistence, now you're building your gut microbiome to be strong enough to handle those beans. And now you're going to handle beans like a pro. Okay, some of you may not feel like that's a viable option, and you're like, just get me to that. I just want to eat the beans. Luckily, there are certain things that you can add to the beans to make it less bloaty for you. So hing is a very common spice used in the Indian cuisine, also known as asafoetida. And this spice has more of a onion and garlicky type taste to it, and when you add it to the beans, it does reduce your bloating. Epazote, I think, is common in Mexican cooking. I meant to look this up before I gave the talk, but I forgot. And then kelp. So if you add these things to the beans, it can be very helpful at reducing the bloat. In terms of prebiotics, we have the foods that they like to eat. They like to eat soluble fiber, which is typically found in fruit, vegetables, whole grains, and they also really like resistant starches, such as oats, rice, potatoes, and legumes. Now, when you add those two things together, they produce something called postbiotics. What the heck are postbiotics? It's magic. That's what it is. These postbiotics help to regenerate colon cells. It maintains the gut barrier. It forms this really nice mucus that helps to protect our colonic cells, nourishing them, repairing them, reduces inflammation, and it acidifies the colon to the right amount, where it again helps to suppress the growth of the bad bacteria and allows the good bacteria to flourish. So short-chain fatty acids are amazing. The other great thing is, too, once you start increasing the fiber, for every 5 grams of fiber that you eat, it decreases the risk of death from colon cancer by 18% and all-cause mortality by 14%. Other great things about short-chain fatty acids, again, they're helping to increase the tight junction so you don't have so much of the leaky gut. The leaky gut kind of shows up in symptoms like diarrhea, symptoms such as diarrhea, constipation, bloating, abdominal pain. Less endotoxins, your gut is able to move better, so less constipation, less sensitivity, and also decreasing the inflammatory markers. All right, so we're going to go into a couple case studies. This is Mr. MK. He's a 20-year-old male. It was the first time I saw him, and he came in. He was a pretty healthy guy, with the exception of like a 14-year history of diarrhea. It wasn't super severe where he was just having like multiple bouts a day. It was like once or twice a day that he would have diarrhea, but it was annoying enough that he brought it up on our physical exam. And he tells me, oh, I've had all of this worked up by previous doctors, and they all tell me I have nothing wrong with me. And of course, I dive into his diet. I'm like, oh, well, what do you eat? And he's like, oh, I try to keep it really clean. I try to keep with the lean meats, fish, or chicken, maybe once or twice a day, lots of veggies. I really don't eat junk food. I know that I need to, my body's a temple. I need to take care of it. I'm like, okay, that's cool. Well, I think we can still improve that a little bit. So as you know, I really try to promote a whole food plant-based diet with all of my patients. And so he's kind of getting a little curious about this. And also I'm like, listen, I don't have access to your records before, and I don't know what your doctor's ordered. So is it okay if I just order that stuff again? He's like, you're not going to find anything. And I'm like, can I? So he allows me to order those things, and of course, everything comes back negative. Anyway, I have a follow-up with him about 3 months later, and I happen to call him on the phone. I'm like, hey, man, how you doing? He's like, I tried eating that whole food plant-based thing, and you won't believe it. My diarrhea is completely gone. I have normal formed stools. They're soft, but I go every day, and I don't have to worry about this anymore, which is really awesome. Our second case is Miss RR. She's a 35-year-old female. Okay, it's me. And I actually presented this to my husband. He's like, you're not 35. I was like, I was. I had suffered from constipation since childhood. I don't know if anyone here speaks Thai, but when grandma was taking care of me, she would give report outs to my mom, and she's like, oh, she went poop today, and she had these little lukusun. Lukusun means bullets. They look like little bullets in the toilet. And as a kid, I don't know anything about it. I thought hemorrhoids were going to be part of my destiny. It just runs through the Ragasa lineage like crazy. And lots of numerous embarrassing events. Like I would go to a weekend getaway, and of course, as everyone's having a nice dinner and enjoying wine together, I have to disappear for half an hour. Where the heck do I go for half an hour? Of course I'm in the bathroom. It was really embarrassing. I did not like this. But I just, again, thought it was something that I inherited from my family. Never really thought about my diet. And of course, I didn't eat badly, I would say. I kind of had the same diet as that first gentleman that I had mentioned. Anyway, I got certified for lifestyle medicine in 2020, so I kind of got inspired to start making these changes because I needed to walk the talk if I was going to teach my patients this. So naturally, I increased my fiber intake from anywhere between 30 and 40 grams a day, and now I go like clockwork. It's amazing. It takes me like 2 or 5 minutes. It doesn't take very long. The only reason why I'm in the bathroom longer is because maybe I'm escaping my children. Don't know. But it's amazing. It's a game changer, and my body tells me now when I feel a little more junkier and I'm kind of indulging more in the vegan foods, like the vegan junk foods, my body tells me, and I'm on the toilet a little bit longer. I'm like, okay, I need to clean it up again, bring that fiber back. Okay, and I really wanted to talk about gluten. Oh man, I have like 7 seconds. There's no way I'm going to get through this. Okay, gluten. We have a lot of patients who have gluten sensitivities. So with gluten sensitivities, they try to avoid it, and they think, oh, I feel better once I avoided this stuff. But studies have shown that we actually do need gluten. Interestingly enough, when gluten is taken away from us, hopefully some of you guys might get this reference. This is from The Little Mermaid. But are those strong mermen or merwomen who made a deal with the devil, essentially, end up getting weaker over time because they're not being fed the gluten that they need. And the good or the bad bacteria end up getting stronger. Interestingly enough, once you put gluten back into their lives, they get strong. The bifidobacterium comes back, and it increases the integrity and the permeability. So why are these people who are avoiding gluten actually feeling, quote unquote, better after they eliminate it from their diet? Well, they actually did a study actually, before we go into that, let's talk about who should actually avoid gluten. So people who should avoid gluten are obviously people who have celiac disease, right? We definitely don't want to give them gluten. That's about 1% of our population. People who are truly allergic to wheat, obviously, we don't want to put them in anaphylactic shock. And then there's a subset of people who have non-celiac gluten sensitivity with extraintestinal symptoms. So this is kind of interesting. Basically, whenever they consume gluten, they will experience muscle pain. They'll have neuropathies. Sometimes they'll develop a rash. These people should also avoid gluten. Everybody else should eat gluten. These are the people who have the non-celiac gluten sensitivity with intestinal symptoms. So those are the ones with the bloating, abdominal pain, and things like that. But please make sure that you rule out celiacs first. Okay, so let's talk about those people and what they're actually having sensitivities to. It's not necessarily the gluten. And this study shows that. Basically, they had these little bars. The bars were given with either laced with like fructan or gluten, or they have the placebo bar. And they were given to patients who claimed they had gluten sensitivities. And when they gave it to those patients, interestingly enough, the people who consumed the gluten bars actually had improvement of their symptoms, whereas the people who consumed the fructan bars had worsening of their symptoms. So maybe these people should not be on a gluten-free diet, but rather focus on avoiding the high FODMAPs foods, right? So high FODMAPs are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. The fructan is a type of oligosaccharide, and if our gut can't deal with it well, it ends up producing a lot of gas for us. Actually, before I go into that, so the different types of FODMAPs include lactose, which is found in milk, ice cream, cheeses. We have fructose, found in fruits and veggies. Fructans, again, we have the gluten grains plus the fruits and veggies. We have galacto-oligosaccharides, which are complex sugars like the beans, and sometimes we get that bleem boat. And then we have polyols, which are the sugar alcohols. So of the 5 things listed there, obviously I have a bias, and I don't think we need the lactose, considering 75% of the population doesn't even have the enzyme to deal with that. And polyols are naturally found in certain fruits and vegetables, but in tiny amounts. But anyway, so the reason why I'm bringing this up is because I don't think I received really good education on this. And I thought that you should be eliminating FODMAPs foods from your diet forever, but apparently this was just an elimination diet, and eventually you should be reintroducing those foods, because obviously if the fructose, fructans, and galacto-oligosaccharides are found mostly in the foods that I just told you are really good for your microbacteria, how is avoiding those foods actually good for us, right? What you're supposed to do is eliminate it for 2 to 6 weeks and then slowly reintroduce it. It's a very long process for patients and can be very frustrating, but if you pair up with a dietitian who's very familiar with slow reintroduction, you are learning how to work out your gut microbiome and get that stronger. So start low, go slow. We do need these FODMAP foods in our diet, particularly the middle ones that I had mentioned earlier, to keep our gut microbiome strong. All right, so my take-home points. Number one, the gut microbiome is integral to our own health. We need to take care of it. There are different types of biotics. We have prebiotics plus probiotics equals postbiotics. We should aim for plant diversity in our foods, aiming for about 30 different types of plants per week. Low FODMAP is only supposed to be temporary, and when you work with a good dietitian who can help them reintroduce the slowly back into their lives, it can be very life-changing for them. Fermented foods are superfoods, and lastly, please remember that cured meats, processed meats are a class 1 carcinogen, and we really need to start teaching our patients about that. So thank you very much for your attention, and I welcome any questions.
Okay, that was really interesting. I even saw the talk ahead of time, and I still feel like I was like, oh, this is better. And speaking on it was amazing. So we have some questions here. I think the first thing is that a lot of us have patients that come into the office with this, eating red meat, bacon on a regular basis. How do you outline a strategy and talk to patients about the SAD diet and how they can move into more of a plant-forward or a plant-based diet?
Yeah, so actually I give them the same stats that I give to you. I tell them that consumption of 50 grams of processed meats daily will increase the risk of colon cancer by 18%. And as soon as I say that, their eyes just like bulge open. They're like, excuse me, I'm getting colon cancer from eating bacon? And I'm like, yeah. So they're really receptive to this information. And then the other thing too is I also include the deli meats and all that stuff. And oftentimes, our patients don't live in a silo. They live with a family. They typically have kids, and they're feeding their kids this too. So one of their motivators might not be their own health, but maybe for their own kids. And I don't point it out to them, but they're like, oh my God, I feed my kids that the whole time, and we have that all the time. So, obviously the person who brings the food into the house is them, and I don't think the parent is going to want to eat bacon in front of their child and be like, sorry kid, you can't have any, right? So it's really about kind of changing everything from the parents.
I think another thing I've heard you say, even we used to work in the same clinic, to our nurses or even to our physicians, is small baby steps, right?
That's true.
So I think you always say plant forward first and give yourself some grace, maybe on the weekends or 2 days a week or whatever days you choose.
I never expect 100%. I know we live in a world we're allowed to party. It's okay. I just don't want, and the way I categorize meats is I'm not here to demonize them. I think, even my dad growing up, he grew up super poor in the Philippines, and he told me I only ate meat like twice a month, and that was the only time my dad got paid, So the way I like to see them is it's a form of celebration. I just don't want you celebrating every day, so it's okay. But yeah, baby steps. And if they're not willing to give up the meat, I get it. Let's work on increasing the amount of fiber they're eating, right? We saw that only 3% of the US population gets enough fiber. So let's work on bringing that up. And as that goes up, there's less room for the meat. And then hopefully when they are eating their meat, it's gonna be a proper portion, which is 3 ounces. It's about half the size of my palm. That's a proper size for meat.
You brought up fiber. Someone asked here about Metamucil powder. Since it has sweetener, is it really a healthy option?
That's a good question. I mean, I'm always a proponent for whole foods, so anything that kind of comes in a container, I'm not really for it. I know that there are some gastroenterologists that do promote it, and even the person who I got a lot of this information from continues to use that to help promote increasing fiber intake. I think the amount of sugar that's in there, though, in the Metamucil is probably minuscule compared to like having a candy bar. So it's all relative, right? Is it healthy compared to what?
Yeah, someone asked here, animal protein is, how can you comment on why studies or data show that animal protein is more absorbable than plant-based protein, like chicken and fish?
More absorbable?
Yes, that's what it's asking. Is it more absorbable?
No, I mean, I think it has more of it, so maybe that's why it's more absorbable. If you attend my next lecture, I have a whole slide that kind of explains that a little bit about protein content. But I mean, just like that other previous slide said, we don't have issues with consuming enough protein. Again, it's the fiber issue. You look at cows, all they do is just eat grass all day. I mean, no one questions cows where they get their proteins from, you know?
Okay. So does whey protein have the same effect as eating red meat in terms of carcinogenic ability?
Ooh, that is such a good question. Thank you for bringing that up. So there are some studies that show, this one goes back to Dr. I think Colin Campbell. Anyway, Dr. Campbell, he actually grew up on a dairy farm. And he was a scientist and was really trying to promote increased protein, especially in the malnourished children in the Philippines. So he went back there, ended up, and milk and meat products in general were more expensive, so he had to find a different way to do it. And he was like, well, beans are really high in protein, so let me bring that to the kids instead. And he found that, once he reintroduced protein back into these kids' lives, all of their diseases kind of got better. And an interesting finding he found while he was away in the Philippines is that he saw that the kids who had more money and were born to richer families ended up having higher levels of liver cancer. And he's like, what is going on? Why are kids getting liver cancer? So he went back home, basically did an experiment where he took mice, introduced aflatoxin to them to induce liver cancer, and then he ended up feeding them different levels of casein in their diet. A low casein diet was about 5%, and a high casein diet was about 20%. So we can also say that might be whey. But anyway, he found that when he fed the mice the higher levels of casein in their diet, they actually had an increased growth, more rapid growth of their liver cancer compared to those with the lower amounts of casein in their diet. So there is this strong tie between animal proteins and promoting the growth of cancer cells.
Thank you. We have a lot of questions and limited time, so I'm just going to ask the last question is, any recipe books, recommendations that you can give for people if they want to switch over to more of a whole food and plant-based diet?
Yeah, for sure. Lots of resources out there. My personal, where I started, because I truly had no idea where to start, my sister's really good at looking stuff up. So she gifted me a book called Isa Does It. It's not an oil-free cookbook. I try to make it as oil-free as possible. Another website I really like is Shane and Simple. He had a really beautiful not experience, but he had a beautiful journey where he himself was struggling with weight. He was probably like 70 pounds overweight and, got scared basically by his levels of the sugars and the cholesterol. So he made a huge change in his life, also enjoyed cooking. But I love his website because, like it says, the name of his website is Shane and Simple. He makes his recipes very easy, so you don't need to go finding all these exotic different types of ingredients in order to make his meals.
Awesome, thank you.